I'm Liz Arthur, and I'm an assistant professor in the College of Nursing and a nurse scientist at the James Cancer Hospital. There is no routine cancer. Just as no two people are alike, neither are there cancers. These are taglines you can read on billboards across Ohio, advertising the personalized care you can receive at the James Comprehensive Cancer Center. I study cancer care delivery and outcomes for LGBTQ+ people with cancer. And when I talk to clinicians, they tell me it doesn't matter to me if someone is LGBTQ+. I treat everyone the same. This reminds me of the concept of being colorblind. I don't mean literally speaking, but I mean the concept of some people say when they look at someone else, they don't notice the color of their skin. It doesn't matter to them, they're colorblind. But of course, this is impossible. We do notice the color of someone else's skin, and we should, especially as researchers and clinicians, because race is a social construct imparts specific health risks. For example, in the US, Black women have much higher breast cancer mortality rates than white women. So this makes me think of a similar parallel concept for LGBTQ+ people. When clinicians tell me it doesn't matter to me what someone's sexual orientation or gender is, I'm just treating their cancer, I call this queer blind. But of course, if we don't know who someone is, we can't provide that personalized care to them, knowing their specific health risks. The most recent Gallup poll reports that 7.6% of the US population identifies as LGBTQ+. And this proportion is actually even higher in younger generations. In Gen Z, for example, my children's generation, 22% or 1 in 5 identify as LGBTQ+. And members of that generation are going to get older and they have higher risks for cancer, and we need to be able to provide them with excellent care. Because we know from research that LGBTQ+ people are at higher risks for some cancers. They're less likely to get screened for some cancers. And there's a study out of Stanford that compared LGBTQ+ breast cancer patients with straight breast cancer patients. And they matched them on things like age and the year they were diagnosed and the hormone status of their breast cancer. And they still found that the LGBTQ+ breast cancer patients were more likely to have a delay in their diagnosis and were more likely to have their breast cancer recur. And these differences, negative differences or disparities, are not due to a tumor characteristic or a genetic mutation. They're due to social determinants of health. The social determinants of health account for over 50% of our health outcomes, the differences from one individual to another. LGBTQ+ people are more likely to experience negative social determinants of health, such as discrimination in healthcare and health insurance, discrimination in employment and in housing. About 3 years ago, I interviewed a young, non-binary breast cancer survivor, and they shared their story with me. You see, they were in the process of being worked up for top surgery, which is a procedure to remove breast tissue to align their body with their identity. During the work of this procedure, they were diagnosed with breast cancer. So instead of having this affirming procedure that's going to improve their quality of life and mental health, they were diagnosed with a life-threatening illness. They shared the story of when they went to see a genetic counselor, and the genetic counselor intended to use their pronouns correctly, but it was awkward because they were using they, them while speaking directly to the patient in the first person, but instead of being upset, the patient said this was the first time that their identity was front and center, and they felt seen and heard during a time when they felt incredibly vulnerable. And shouldn't everyone diagnosed with cancer feel like that? Stories like these inform my research, and I would like to share with you 3 research studies, one that I've completed, one that I'm working on now, and what I propose to do next. So the study that is completed, my team and I did a study to determine the best ways to collect sexual orientation and gender identity, or SOGI, data in the electronic medical record. And this is important for 2 reasons. First of all, as a clinician, I need to know who my patient is and what their risk factors are so that I can provide that personalized care for them. But second, as a researcher, I need the data. I need information in the medical record about sexual orientation and gender identity that will then feed up to the state level cancer registry as well as the national level so that we can have national data on incidence and prevalence, morbidity and mortality for LGBTQ plus people, similar to what we have for race, for ethnicity, for age. Our team is really proud because this project was actually translated into clinical practice, and we're now collecting SOGI data in the medical record at the James. Second, a study that I'm working on now. I mentioned the study out of Stanford where they compared LGBTQ plus breast cancer survivors with straight breast cancer survivors. We're doing the same thing, repeating that here at Ohio State in breast cancer as well as prostate cancer. And we hope that the results will give us an indication of how we're doing here in Ohio. Lastly, the study that I propose to do next, and I'm currently seeking funding for. You may have heard of patient navigation. The role of patient navigators is to help patients access needed healthcare services and also identify resources to address social determinants of health. In fact, there's so much evidence for the effectiveness of patient navigation, especially in oncology, that their services are reimbursable by CMS, the Center for Medicaid and Medicare Services. Peer navigation and peer support in the LGBTQ plus community has its roots in the HIV and AIDS epidemic of the 1980s, when peers and friends and ex-lovers stepped in to care for people affected by HIV when some biological family members and healthcare providers turned their backs. But no one has ever studied navigation for LGBTQ plus people with cancer. So I propose to develop a peer navigation intervention for LGBTQ plus people diagnosed with cancer. October 25th, 2022 is a date I will never forget. I will always remember exactly where I was and exactly what I was doing when I learned that I had invasive lobular carcinoma. I had breast cancer. I was diagnosed 4 days before our daughter Claire turned 8 years old. She's the youngest of 4. But through the support of friends and family and colleagues and neighbors, I made it through my treatment, and 8 months later, I was riding again in Pelotonia, this time with the word survivor on the back of my jersey. This is a picture of me at the finish line of the 50-mile ride with one of my breast cancer doctors. Being diagnosed with cancer was by far the scariest thing that has ever happened to me. But I had a relatively easy time because I was diagnosed at an early stage and my oncotype score was favorable, so I didn't need chemotherapy or radiation. And I'm white, I'm cisgender, I have great health insurance, and I'm a clinician, so I know about the disease, I know what to expect from treatment, and I know how to navigate the system. But not everyone has that same experience. So what did I learn? First, I developed a deeper empathy for all those who hear the words, "You have cancer," and for the vulnerability that you feel sitting across from a surgeon who literally has your life in their hands. I also learned a deeper appreciation for competent and compassionate clinicians. I had a great surgeon, and still, I remember sitting in the exam room in one of my preoperative visits, holding up my phone and asking her to look at the pictures of my 4 beautiful children, because even though she knew me as a clinician, as a researcher, I wanted her to know me as a human being and what was important to me. Lastly, I developed a deep determination that every individual diagnosed with cancer should feel as seen and safe and cared for as I did. For more information about my work, please see my faculty profile on the College of Nursing website. Thank you.